So, you are a researcher here at the University of Porto. Could you tell us more about yourself and your academic and professional background?
Well, I'm a medical doctor. I'm a gastroenterologist by training, but I stopped doing clinics for a long time now. But I was trained both as a clinician and an epidemiologist. So if I look back, I would imagine myself being a clinical epidemiologist, but life changed things. And as my initial research has much to do with viral hepatitis, so infections, and mother-to-child transmission of this viral hepatitis in those days, especially hepatitis B. This to a certain extent shaped my research. So I worked a lot with infectious disease and perinatal health, meaning all that happens around pregnancy, birth, and the first times of life. Of course, epidemiology, what I'm doing now, is both a science and a profession. And in the university, we do both. We research using the methodology of epidemiology, and we train epidemiologists to work both in hospitals or primary healthcare centers doing quantifying the clinical aspects of disease, or as public health professionals.
What is your research focused on right now, and why did you get interested in that topic?
Well, so as you saw, I began with infections and mother-to-child transmission of diseases. And what I'm now mostly interested is in social aspects of getting those infections, and especially how social and behavioral determinants influence the occurrence of diseases, and especially shape the way we are going to grow, and so what's going to happen with us in the future. With a special topic now I'm interested for a long time. It has to do with abuse, with violence. So how social determinants, social aspects of life change biology, and those might change the course of diseases, or even the fact that they appear more often in certain populations than in other populations. A major aspect of the type of research I do is that I'm not that much interested, let's say, with Mr. A or B, but I'm interested in how a disease, how a health problem appears, and what type of dynamics that topic has in a certain population. And the final question is why a population, a certain population, has more cases of ill health than another population. What can we do to shape or reshape the future of people?
In what way does your research contribute to global health issues?
My research is mainly global health, because it was before the name was kind of, the label was used, because dealing with the perinatal epidemiology, we are dealing with one of the most relevant aspects of health, the circumstances under which people is born, and what we can do to avoid losing lives very early in the life course. And these aspects, motherhood or infectious agents, as we have seen recently so well with COVID-19, they travel around our lives, around our communities, around our regions, and around the planet. So maybe what I'm doing now is closer to planet health, if we can bring also aspects like climate changes or war, which is a major public health issue, then even the relatively restricted, reductionist approach of global. Global is now a reduction, if you want.
What are the practical implications of your research and the impact it can have for future generations?
At least in theory, decision makers, politicians, should decide, should make choices, as all of us, based on evidence. What we provide with our research is evidence for action. So when we show that there are circumstances that increase the risk of transmission of an infection, for instance, we are offering at least approaches to try to change the course of things and make prevention. Or even more than prevention, when we discuss social aspects of health, we are remembering people that if you want to increase the health capital of each of us and of each population, we need to be very careful about social aspects like the house where you are living, the air you breathe, all these aspects that are the essential, what we can call the cause of the causes. Because obviously, if you smoke, you get lung cancer. But why, in first place, do you smoke? Because our society is organized in a certain way. When we look to each other when we are kids, we value certain behaviors, certain ways of being. So all this very complex system that makes health and disease. That's why I think my science is one of the most amazing, most challenging and most fantastic, because we try to close the puzzle, getting pieces from everywhere. So when you look to the puzzle to make a decision, you point to, oh, this is the problem here. It might be different from there.
How is your research transferred to the classroom? For example, are there any innovative pedagogical methods that you use?
I must confess that I don't know exactly what's innovation in pedagogy. I know I shouldn't say this, but what I mean is that what I tried as a teacher was to make people be interested in the things that puzzled me, or dealing with infections, it's easy to understand. What I try is to make a sort of contagion to my students. Sometimes I did it, sometimes I was unable, but I think what I try to avoid is this relatively common idea now that the student is a client. The student is not a client. Studying is working, and it's working hard, and the important thing is to be able to discuss and to bring good arguments to the table, better arguments than the teacher's arguments. That's the game for me.
How do you look on the role of international cooperation and university alliances such as EUGLOH?
I think these are great because science, at least since the Middle Age, has been traveling around, meeting people, sharing ideas, discussing, arguing, and we need to keep that. And that probably goes much better if we meet, if we eat together, if we walk around, if we visit the same monuments, because those are the real situations of life that might influence you, that might inspire you. And to make it very simple, when you bring together universities with different cultures, different traditions, different histories, even different levels of development, they might, in the end, help all of us to become better, to learn with each other. And if we are clever enough, we'll take just the best of each other.
In your opinion, what are the greatest global health challenges?
If we think about health, the major determinant of health is poverty. That's why sometimes it's strange, many of the things that we try to look at, for instance, when we are looking at epigenetics, trying to understand how we are able, let's say, to make genes expressing or not what they are expected to do. And we change that just by moving the social aspects of things. It's difficult to understand, but in reality, poverty, inequalities are the major driver of disease. So if we don't manage to influence the distribution of wealth, it's very difficult to do whatever in health, because even when we try to fix the problem of an individual as a patient, he will go back to the same environment where he got disease. So this is a never-ending cycle, and we need to cut this cycle.
Well, thank you so much for joining us in this coffee break with EUGLOH.
Thank you.